Greetings and welcome on behalf of the Global Nutrition Report and the Indian Nutrition Initiative, an initiative of Tata Trusts. I would like to welcome you all to the launch of the 2020 Global Nutrition Report, Action on Equity to End Malnutrition. My name is Rini Simon Khanna, and I thank everyone for taking the time today to join us for this very important event, especially in the light of the global crisis the world is now facing. This was supposed to be a live event in Delhi. However, we are delighted to have been able to adapt to the situation and bring all of you together online. Around the world, COVID-19 has exposed the fragility of food and health systems, disproportionately impacting already vulnerable populations. You will agree that access to nutritious and healthy food and good healthcare is critical and crucial to avert the worst effects of the pandemic, especially for the world's poorest and most vulnerable people. As you're also aware, malnutrition affects our immune system, leaving us more susceptible to infection, and the socioeconomic impact of the pandemic could in turn drive malnutrition globally. As we look to reinforce our resilience to global stresses, nutrition must become a key component of any emergency or long-term response. So it is within this context that the 2020 Global Nutrition Report is being launched today. As ever, the GNR represents the most comprehensive picture of the state of nutrition globally and tracks progress against global nutrition targets and the commitments made by stakeholders to reach them. Uniquely, this year, the report also presents a new analysis that goes beyond global and national patterns, unveiling significant inequalities within countries and populations. By applying an equity lens to examine the global burden of malnutrition, the 2020 report provides a fuller understanding of nutrition inequalities. And in doing so, the report pinpoints and prioritizes key actions to amplify efforts and propel progress towards ending malnutrition in all its forms. Ladies and gentlemen, the Global Nutrition Report is not just a global report. It covers both the national and subnational, acting as a tool for countries such as India. As I mentioned in the beginning, this year, the GNR has collaborated with the Indian Nutrition Initiative to launch the 2020 report. India is a country that knows all too well the impact of inequalities and inequities in nutrition. Yet, despite facing multiple burdens, it continues to strive towards progress and a society free from all forms of malnutrition. Building on India's commitment to this issue, this launch event will not only set the scene at the global level, but will also highlight progress at the national level in India and beyond. Before I share more with you, allow me to briefly outline the format for today's online event. We will begin in a moment with keynote speeches by two esteemed guests, Professor K. Srinath Reddy, President of the Public Health Foundation of India, and Ms. Herda Fabbri, the UN Assistant Secretary General and Coordinator of the Scaling Up Nutrition Movement. Following their opening speeches, we will share with you a recorded presentation on the 2020 GNR delivered by the co-chairs of the GNR's independent expert group, Dr. Renata Miha and Professor Venkatesh Mannar. Reflecting on this presentation will be our esteemed panelists. We've got Johanna Ralston, CEO of the World Obesity Federation, and Alok Kumar, Senior Advisor to the Niti Aayog. I will invite now our panel to share with us their views and perspectives on the report's findings after they have listened to the presentation and also present us with the recommendations. So building on these reflections, we will then move to the Q&A, where I will invite you all to pose questions, and you are to use the Q&A box to pose those questions. Before we dive deeper into the event, let me share a few housekeeping notes that I request you to please follow strictly to enable a smooth event. all through the webinar, members of the GNR team are going to monitor both the chat box and the Q&A box. As much as we want this to be as interactive as possible and as close to a live event, we are forced to request you to please share your comments and reflections in the chat box and reserve your questions for the Q&A box. If you wish to ask a question, please use the Q&A box and be sure to include your name, the name of your organization, and the speaker your question is directed at, if it is not a general question. Do note that if we have space, only then we'll be able to accommodate one or two audience questions. If you have a technical question that is related to the report's data, may I ask you to please send it directly to the GNR inquiries inbox, and you can see the address on the screen now. The data team will of course do its best to respond promptly. When we get to the moderated Q&A, we'll begin with a couple of pre-prepared questions and then select one or two questions from the Q&A box, depending on time. If your question is not selected during the session, please don't worry. The GNR team will do its best to respond to you after the launch. Just to say again, you can send those questions to the GNR inquiries inbox, as is shown on the screen. Do bear with us, as there are many technicalities that our team has to keep in mind. You're of course welcome to engage with the GNR on social media and do tweet as we progress. Lastly, just a reminder that this event is being recorded and will be uploaded onto the GNR website and onto the GNR's YouTube channel. So without much ado, I'd like to introduce our first keynote speaker, Professor Srinath Reddy from India. Professor Reddy is the president of the Public Health Foundation of India and formerly headed the Department of Cardiology at the All India Institute of Medical Sciences. In March 2017, Professor Reddy was also appointed as advisor on health to the government of Odisha with the rank of a cabinet minister and served as physician to 2 prime ministers of India. Thank you, Professor Reddy, for joining us. I'd like to invite you now to please give us your keynote address.
Thank you, Rennie. As you very aptly remarked at the very beginning, nutrition is the foundational basis of health and well-being across the entire life course. But health and nutrition are not just the biological elements that characterize the body, but they are the manifestations of myriad social and environmental forces that act ultimately in shaping what those biological processes are. So the determinants extend from cell to society, and nutrition reflects each one of those links most vividly. But we also recognize that all these links and ultimately the manifestations of nutrition are most profoundly affected by inequality. If nutrition and health are the best summative indicators of success in the Sustainable Development Goals, then impaired nutrition and health are the most poignant image that the cumulative burden of multiple inequalities project in a person who is subjected to these kind of inequalities from preconception to the demise. We do recognize that there are multiple factors that are affecting nutrition even in India. And we recognize that in terms of childhood malnutrition, which has been a challenge for quite some years, we see even now stunting in under 5 children affecting 34.7% of the people, of the children. But at the same time, we see an urban-rural differential of about 10% with a rural preponderance. Similarly, even in terms of underweight, we find, again, a 10% difference in the urban-rural indicators. We also recognize that anemia in older children, adolescents, and women in reproductive age group is also a phenomenon that greatly impairs health and productivity. At the same time, we see the other face of malnutrition in terms of what is conventionally called overweight and obesity and linked to non-communicable diseases, a wide variety of them. But in India, we also see that there is a greater degree of body adiposity in what is generally considered to be in the normal range of body mass index, which means that we have metabolic obesity because of increased body fat content and visceral adiposity, even when the threshold of overweight and obesity are not reached by the conventional BMI indices. We also recognize that we have a multitude of non-communicable diseases now very well established in urban populations, but also burgeoning in the rural populations. But just to make a point about how even visceral adiposity in the absence of general obesity makes a huge difference, we have about a third of our diabetics as thin diabetics. But we also recognize that if poverty and disadvantage are the features of undernutrition, very clearly so, we also see a reversal of social gradient when it comes even to the whole area of non-communicable diseases. And we see now that the poor are increasingly becoming the more vulnerable victims of malnutrition because they cannot afford appropriate diets at affordable cost. Therefore, we have a combination of both inadequate and inappropriate diets, which are principally driven by economic factors. We also recognize there is an intergenerational element of inequality, where malnutrition during pregnancy and early childhood can actually cast a long shadow into early adulthood, predisposing to a variety of non-communicable diseases. And these are principally due to epigenetic changes which alter gene function and expression. But this can also have more generations affected. If a woman is malnourished during pregnancy and she has a female fetus, then the ova of the female fetus also undergo epigenetic changes, so that not only the child yet to be born, but the child yet to be conceived also can be affected by these epigenetic changes that can express as impaired nutrition over the course of at least 3 generations. So we are seeing that there are multiple areas of inequality, but certainly we also see that whether it is COVID-19, which you spoke about, and certainly affects by way of food insecurity, income insecurity, disruption of social protection programs, and ultimately causes a huge problem in terms of nutrition security, or whether we are talking in terms of climate or conflict, all of these actually ultimately result in various forms of vulnerability to various sections of the population, and the poor usually end up suffering the most. Therefore, addressing nutrition purely through the biological lens would be most inappropriate, and I'm happy that the Global Nutrition Report now actually is looking at nutrition also through the social lens of inequality and is calling for multiple actions to address those inequalities across the life course of individuals and ensuring that nations respond through a combination of policy responses. As the British economist Tawney said in early 20th century, it is not just a matter of equality of opportunity, it is essential to ensure equality of circumstances. And therefore, we require a much more profoundly understanding approach to solving the problem of inequality as it affects nutrition. And I'm glad that the Global Nutrition Report is addressing all of these facets. And India, in particular, will stand to gain a lot and also contribute a lot in terms of this knowledge exchange. Thank you very much.
Thank you very much, Professor Reddy, for that rather inspiring address. Your years of research and, of course, in-depth understanding of the subject shone through. So thank you very much, sir. I'd like to now introduce our second keynote speaker, Ms. Fabbri. Since 2016, Reddy has served as the UN Assistant Secretary General and the coordinator of the Sun Movement. As part of this role, Reddy works tirelessly with the 60 country governments that lead the Scaling Up Nutrition movement to tackle malnutrition in all its forms. At the outset, Thank you very much, Ms. Fabbri, for being here with us. I'd like to now invite you to please give us your address.
Address this meeting, especially since the speech of Professor Reddy, and I have nothing to add there. So let me be a little bit more operational. First of all, I'd like to praise the whole GNR team who has worked so hard on this. And though this report has been finalized, almost finalized before the COVID-19 crisis was hitting almost every country, this report is crucial to take lessons, to look into the mirror, and to make the Global Nutrition Report a guidance for our government and for all different sectors and stakeholders to guide the way forward. And I'm also very happy to see the lens on inequalities, because we all are aware of inequalities, but in this Global Nutrition Report, we see that the most vulnerable women, minorities, poor people, and other groups in society are left behind. And we are in the age of delivery, almost a decade of delivery on the global nutrition, on the Sustainable Development Goals. And there is one thing that we should keep in mind. We cannot afford, and we shouldn't allow ourselves to leave anyone behind. So having said this about the Global Nutrition Report and being aware of being in the COVID crisis, we can already learn a lot of lessons here. That the focus on nutrition is now more crucial than ever. If you look at all the support, there is of course a lot of support to health, but where is the health connected to the nutrition actions? Where is the support for mothers, where Professor Reddy was focusing on the focus on breastfeeding, but also the prevention of being vulnerable to the virus, whether you are undernourished or whether you are obese or overweight or have one of the NCDs, it has been sorted out that you're more vulnerable to be a victim of the virus than if you are in a good nutritious conditions. But we also need to learn that a lockdown can be a good prevention opportunity, but at the same time, it is disrupting food systems, it is disrupting economic cycles, it is creating unemployment, it is disrupting financial services, and many people in developing countries, lower income and middle income countries are hit hard by this. And this is also very true for the food system, because we see a lot of people, if they don't have a job, if they cannot go to work, they don't have an income, and they are vulnerable to not be able to buy their usual healthy food. So they are enforced to buy, to focus on qualities, but also small and medium-sized companies who are eager to contribute to healthy food systems are very often not able, let alone many farmers that deliver at school, or school kids that go to school and get nutritious meals. So that is the picture that we see right now. So we have a lesson to learn here, to have a coherent package of response, but there is also response to the COVID crisis in many vulnerable countries. But there's also something to learn on how to build back better, because there will be a time that we are able to overcome and to build back better and stronger. And what are these lessons that we can learn from the pre-COVID crisis, from the during, and what are the post-COVID-19 lessons that we can learn and that are building on the GNR? First of all, that nutrition is too often still looked at from a health lens and perspective. And this must be broadened, because the Minister of Agriculture should also be proud to call him or herself the Minister of Nutrition. Agriculture is not there to only nourish GDP and to be proud to contribute to export. The Minister of Agriculture should be proud to be the minister that is nourishing people through healthy and diverse food. But it should also be part of education, of social protection, of gender equality. Very often women are taking care of the food for the family and are delivering, of course, the new generation, but are hit hardest and are very often more vulnerable to malnutrition. So these are the lessons that need to be learned. And for that reason, I would make the statement here that nutrition needs to be at the heart of every socioeconomic development plan at country level, including when it comes to investment in it. My next point, donors right now are investing about 1% of their budget to nutrition. And the Global Nutrition Report is telling us that, that in this speed, we will not be able to live up to the WHO targets on nutrition. And being thrown back through the crisis, it is even more crucial that donors invest more of their budgets in nutrition. Why? Because there is about $7 billion a year needed to end all forms of malnutrition by 2030. And we should not forget that good nutrition is the engine, is the catalyst, is feeding at least 12 of the 17 Sustainable Development Goals. And at the same time, if nutrition is done well and in a multi-sectoral, multi-stakeholder way, the return on investment, according to the World Bank, is $16 to each of the invested dollars. And it's the engine for socioeconomic development, exactly because of the fact that good nutrition is nourishing the body, but also nourishing the cognitive development. And smart and healthy people are happy to serve their country to better socioeconomic development, to a healthy society and a healthy planet. So what can we do here? We are all aware of the fact that the Olympic Games are postponed, and for that reason, also the Nutrition for Growth Summit is postponed. We don't know exactly when it will happen, but let me make an appeal to donors here to make their commitment on financial investment, but also on actions to invest in nutrition in the years to come, to end this crisis and to come to build back stronger. And we will do everything with our 61 member countries and plus 4 Indian states to applaud them during the Nutrition for Growth and make it possible to announce it there. I also would like to make an appeal to all countries to already anticipate the fact that next year we will have a Food Systems Summit. And in this Food Systems Summit, of course, there need to be a focus on sustainability when it comes to our planet. But let us not forget to put in every step we make in improving our food system to include nutrition. Make sure that farmers can invest in more foods, more diversity, and that they are rewarded also for their services that they are investing in the planet. Water resources, carbon storage, and whatever. So please make also your commitments for the Food System Summit and let this Global Nutrition Report guide you there. I also want to make an appeal to businesses, because businesses, not only in the food sector, but broader, can show leadership. They wanted to be recognized as leading also in the implementation of the Sustainable Development Goals. Now they are able to lead. Don't offer your government and your society food support that is not healthy, that is not nutritious, but that's sugary, that is fat, that is too salt, etc. No, if you are there to support, please do it in a responsible and honest way. Don't start to promote breast milk substitute, but instead support societies and communities to support women, pregnant women and adolescent girls to breastfeed their children, because we all know that breast is the best. Please also make your voice heard when it comes to avoiding small and medium-sized companies to lose all their activities and lose their income and have to dismiss their people. I can continue here. But I also want to make a plea for NGOs. NGOs, wherever they are, they will do their utmost to stand in between communities, to be part of the social fabric and to support wherever they can. Let us not forget them, not as a government, not as donors, not as investors. Invest in your civil society because, as I said, they are the social fabric of our societies. So to come to an end, I would say this Global Nutrition report is an excellent report to guide us out of this COVID crisis, which is also a nutrition crisis and can hit people even harder than it's already happening right now. Let's not underestimate it, but it is also teaching us the lessons. Work together with multiple partners, leave no one behind, build back stronger and better, and from time to time look into the mirror of the Global Nutrition Report. That is exactly what we as a Sun Movement do every year. And since this year is our 10th anniversary, and next year we will start our next phase of the Sun Movement, the Global Nutrition Report is our guide, and we are happy to work together with the members that are already a member of the Sun Movement, but we are also open for new members to join forces and make malnutrition part of the past. Thank you so much.
Thank you, Reddy. That was a lot of plain speaking and good speaking that you did there and raised a lot of good points there. Thank you, Professor Reddy and Ms. Fabbri, for speaking to us and really energizing this launch with your stimulating words. And I know that there's a lot of room there for us to reflect on and ponder about. So, ladies and gentlemen, we now move on to the presentation of the 2020 Global Nutrition Report. We would like to remind you that this presentation has been pre-recorded by the co-chairs and will be made available on the GNR website after the launch. Before the presentation begins, let me introduce the GNR's new co-chairs formally. Dr. Renata Mija is an associate professor at the Friedman School of Nutrition Science and Policy at Tufts University. Dr. Mija's research aims to produce high-quality evidence on dietary priorities for optimal health, corresponding disease burdens, and cost-effective policies to reduce these burdens. She is a recognized expert in the field of nutrition and food policy. Professor Venkatesh Manar is Special Advisor on Nutrition to the Tata Cornell Agriculture and Nutrition Initiative. Professor Manar was president of the Micronutrient Initiative Canada for almost 20 years and has co-developed cutting-edge technologies to enhance the nutritional quality of foods. So a quick hello to both of you. Thank you for presenting this report. Dr. Mija, if I could ask you to greet the audience at this point.
Hello, everyone. This is Renata Mija, and thank you so much for joining us today.
Professor Manar, could I ask you to please greet the audience as well?
Hello, everyone. This is Venkatesh Manar. Very happy that you're able to join us for this presentation today.
Thank you. So without any more delay, let's begin the presentation of the GNR 2020.
Thank you, everyone, for joining us. I am Renata Mija, one of the two co-chairs of the independent expert group of the Global Nutrition Report. It is with great pleasure that my fellow co-chair Venkatesh Manar and I will be presenting you the 2020 Global Nutrition Report. This year's report highlights action on equity to end malnutrition. Why action on equity? Because we will never end malnutrition unless everyone is treated fairly and according to need. Inequity is our defining challenge in ending malnutrition in all its forms. Most people cannot access or afford a healthy diet or quality nutrition care. This access is hindered by unjust systems and processes holding people back from healthy diets and lives. Unfairness, injustice, and social exclusion are determined by social factors such as wealth, sociocultural perception of age, gender, and ethnicity that in turn impact everyday living conditions. These social determinants are the root causes of nutrition inequity that can lead to unequal nutrition outcomes. For example, poorer people may not be able to afford healthy food, or such options may not even be readily available in their communities, leading to worse nutrition outcomes. This in turn can lead to more inequity, as a sickened person may be less able to work, perpetuating a vicious cycle. The consequences of nutrition inequity are evident. We live in a world where 1 in 9 people are hungry or undernourished, and 1 in 3 people are overweight or obese. Nutrition equity is our defining opportunity to fix the global nutrition crisis. Everyone deserves and should have access to healthy, affordable food and quality nutrition care, which is not simply a matter of personal choices. We need to remove systematic barriers and create opportunities for everyone to achieve that through pro-equity nutrition actions within our food systems and health systems. The COVID-19 pandemic has exposed the weaknesses of our food and health systems and made clear that food and nutrition are now more important than ever. The need for more equitable, resilient, and sustainable food and health systems has never been more urgent if we want to prepare our communities for future shocks and avoid a reversal of gain. Now is the time to act in coordination and make nutrition central to any emergency or long-term response. So who is most affected? To answer this question, the Global Nutrition Report sheds light on the state of global nutrition and progress towards the global nutrition targets. It uses new and more granular data to go deeper and understand who is affected, where, and by what form of malnutrition. The analysis reveals that progress is too slow and deeply unfair, with global patterns hiding significant inequalities between and within countries. Looking at the maternal, infant, and young child nutrition targets on a global level, there has been some progress for exclusive breastfeeding and low birth weight, yet accelerated improvements would be needed to reach the 2025 targets. All other targets are off course. Stunting still affects 149 million children under 5 years of age, while there are 40 million overweight children. At the same time, all diet-related non-communicable disease targets are globally off course and at alarming levels. Globally, 1.13 billion adults have raised blood pressure, almost 680 million people are obese, and 422 million people are diabetic. Overall progress varies across countries and by form of malnutrition. No country is on course to meet all global nutrition targets being tracked, and just 8 countries are on track to meet any 4 targets. Overall, malnutrition persists at unacceptably high levels, and intensified efforts and actions are needed to reach those targets. There are 2 sides to the global nutrition crisis we're facing: the major global impacts of food insecurity and undernutrition, which have long been recognized, and the tremendous diet-related chronic disease impacts that have more recently emerged. Looking at global prevalence by age, gender, and over time, underweight still mostly burdens children and adolescents. Despite some improvements, it is still high, roughly 32% in boys and 26% in girls. Meanwhile, our world has transitioned to one in which more people are overweight or obese than underweight. Overweight, including obesity, is on the rise across all ages, while similar patterns are seen on a country level. We need more concentrated efforts and actions to slow down and stop the worldwide rise in overweight and obesity. The report looks further at potential inequalities in the prevalence of underweight, overweight, and obesity between countries, as determined by country income. Underweight is a persisting problem of the poorer countries. Prevalence is higher in low and lower middle income countries, both in children, adolescents, and adults, up to 10 times higher compared with wealthier countries. The reverse is seen for overweight, where prevalence is higher in high and upper middle income countries, up to 4 times higher compared with poorer countries. Likewise, obesity prevalence is higher in wealthier countries, up to 5-fold higher. To explore whether conflict or other forms of fragility exacerbate inequalities between countries, we assessed whether the percentage of countries with overlapping high levels of stunting, anemia, and overweight varies by fragility. New analysis demonstrates that fragile countries, 46.5%, and extremely fragile countries, 46.7%, are disproportionately burdened by high levels of all 3 forms of malnutrition compared to non-fragile countries, 7.4%. These findings highlight the need to understand and address drivers of fragility itself and how these can lead to inequalities. Geospatial analysis can be used to inform decision makers by identifying countries with the largest within-country inequalities and pinpointing locations with high levels of malnutrition. The largest inequalities in stunting are observed in Nigeria, Indonesia, and India, where levels vary 4-fold across communities. Greatest inequalities in wasting are estimated in Indonesia, Ethiopia, Nigeria, and Kenya, with 9-fold differences across communities. Within-country differences in child overweight are highest in South Africa, Peru, and China, up to 3-fold. This data can be used to direct resources to the areas of greatest need. The report goes even deeper to characterize inequalities by population characteristics, such as age, gender, education, and wealth, to show that vulnerable groups are often the most affected. For example, there is a clear link between infant and young child feeding practices and household characteristics. Continued breastfeeding up to 1 or 2 years is less common for children in wealthier households, urban areas, or with a more educated mother. In contrast, rates of solid food introduction and minimum diet diversity are substantially lower for children in the poorest households, rural areas, or with a less educated mother. Though we know enough to act, better and more granular data are needed to inform the design of equitable interventions. Such nutrition inequalities stress the need to make both our health systems and food systems more equitable. Let's start with our health systems. Leadership and governance form the core of a strong health system and are critical to addressing nutrition inequities through strengthened policy frameworks, oversight, and coordination. Looking at the inclusion of actions related to global nutrition targets in health sector plans by country income, we see that the focus of lower income country plans is mainly on countering undernutrition, especially through promoting exclusive breastfeeding and reducing anemia and stunting. In contrast, high-income countries focus more on overweight, obesity, and diabetes. It is important for lower-income countries to not overlook diet-related chronic diseases. Higher-income countries should also recognize the persistence of anemia and low birth weight still experienced in vulnerable populations. The low level of attention paid to breastfeeding in high-income countries is concerning, given its role as a double-duty action. Countries need to ensure that their policy instruments are fit to tackle both sides of malnutrition, particularly when these coexist. Malnutrition in all its forms has become the leading cause of poor health and death, and the rapid rise of diet-related chronic diseases is putting an immense strain on health systems. WHO's 6 building blocks of a health system provide a helpful framework for identifying key challenges and opportunities in the comprehensive integration of nutrition into healthcare. Our analysis reveals key challenges. Strong government coordination on nutrition is often lacking, with only few countries having a designated coordinating nutrition unit. The number and distribution of trained professionals is not equitable. Globally, the median number stands at only 2.3 per 100,000 people, 0.9 per 100,000 people in Africa, while some countries have no trained nutrition professionals. Nutrition actions only represent a minuscule portion of national health budgets, although they can be highly cost-effective or even cost-saving solutions in the long term. Important nutrition products and technologies are not readily available to all. Nutrition services are limited and largely focused on undernutrition. Health records and checks are not optimized to assess nutrition, and there is a lack of national surveys comprehensively assessing diets and the nutritional status of populations. Each of those challenges presents an opportunity. To improve diets, save lives, and cut healthcare costs, nutrition should be mainstreamed in health systems. How do we do that? Invest in human resources to increase the number of qualified nutrition professionals and use a variety of health professionals and workers to level out access to quality nutrition care. Develop and align costed nutrition care plans with healthcare financing plans, scaled up and sustained to cover all forms of malnutrition. Include nutrition-related health products like therapeutic foods and innovative technological solutions like digital nutrition counseling. Optimize health records and checks for nutrition care to deliver preventive and curative nutrition services and identify those in greatest need. Integrate nutrition in public health surveillance systems to strengthen the evidence base and inform targeted priority setting. These solutions have a heightened significance in the face of the COVID-19 pandemic. Good nutrition is an essential defense strategy to protect populations against epidemics, release the burden on our health systems, and save lives. I will now hand over to Venkatesh Manar for the second half of the presentation.
Thank you, Renata. What people eat is critical to their nutrition and health. Yet, poor diets are not just a matter of personal choice. Often, people cannot access or afford a healthy diet because of existing inequities in food systems. We must therefore transform our food systems to make healthy and sustainably produced food the desirable choice for all. How do we achieve this change? The food system covers the spectrum from the production of food to its consumption across 4 interdependent pillars: food supply chains, food environments, individual level filters that influence consumer decisions, and finally, the consumer response. Inequitable processes affect each component of the food system, resulting in unequal outcomes ranging from poor availability and affordability of healthy foods to an overabundance of food of low nutritious quality. Food systems are also changing rapidly because of external drivers such as climate change, urbanization, and globalization. The focus of the report is on the food environment, which is the space where supply and demand interconnect. It determines the types of food available, the physical access to these foods, affordability, food promotion and advertising, quality, and safety. Within food environments alone, inequities can be substantial and deserve special focus. In terms of availability, existing agriculture systems are largely focused on staple grains like rice, wheat, and maize, rather than a diverse range of foods that includes fruits, nuts, and vegetables. Looking at access and affordability, for the rural and geographically isolated in many parts of the world, fresh foods are less accessible compared to staple grains or processed foods. For the poor and most vulnerable groups, nutrient-rich foods such as animal source foods, fruits and vegetables are often not affordable. Food quality is another issue. Packaged and processed foods comprise a growing share of diets around the world, especially given the rapid spread of supermarkets and fast food chains. These foods are often highly processed and unhealthy. Lastly, how food is promoted and advertised influences consumer behavior and consumption patterns, both negatively and positively. Ultra-processed foods are cheap and intensively marketed to lower income groups. A pandemic like COVID-19 can further exacerbate all of these issues within the food system with devastating consequences. Equity-sensitive food systems can address many of the challenges by making healthy foods the accessible, affordable, and desirable choice. Here is how governments, the private sector, and civil society can work together to address the challenges. Food availability can be improved through policies and investments to diversify food production. Accessibility and affordability can be mitigated with support for basic infrastructure such as public transport schemes and shorter supply chains for fresh foods. Food quality should be prioritized through fiscal instruments like taxes on sugar-sweetened beverages and unhealthy foods, and regulatory mechanisms such as the ban on trans fats. Marketing and advertising of foods and drinks can be balanced with regulation combined with public information campaigns to provide consumers with complete and unbiased information. Only by tackling injustices in food and health systems will we achieve the transformations needed to end malnutrition. To do this, an equity-focused approach to nutrition finance is essential. The intensified drive needed to meet global targets and end malnutrition is the collective responsibility of all sectors and countries. But what does it cost? According to projections made by the World Bank in the investment framework for nutrition shown here, more than $9 billion per year of additional funding is still needed. Currently, overall levels of financing are static, inequitable, and far below levels required. In many countries, the proportion of expenditure directed to nutrition remains low. Although donors have increased spending within the range of the investment framework's priority package, it is still not enough. The increasing prevalence of overweight and obesity in the developing world needs to be addressed simultaneously with additional financing. With all these demands, countries face a gap that will widen unless they scale up funding substantially. The scale of additional funding for nutrition calls for both a renewed and expanded commitment by countries and donors, as well as new and innovative sources of investment. ODA needs to increase and target populations most in need, including those that are fragile or have limited options for funds. Governments must increase domestic financing, both directly and through multi-sectoral approaches. The level of additional funding required calls for the scale-up of other sources of investment. Voluntary contributions, additional solidarity contributions, and domestic investment mechanisms can all catalyze private investments and incentivize efficient utilization of development resources. Two related actions will greatly facilitate targeting. We need to invest in data management systems for financial flows that identify the most deprived and marginalized communities to prioritize funding. Evidence from economic evaluations of the full range of nutrition interventions, both direct and through multi-sectoral actions, will inform scale-up decisions. Investing in nutrition, renewing and expanding commitments, and strengthening accountability takes on a new urgency given the potential for a well-nourished population to better confront chronic diseases, pandemics, and global shocks. The report makes the case for governments, businesses, and civil society to enable faster, more equitable progress towards ending malnutrition in three key ways. One, mainstream nutrition as a basic health service by leveraging existing infrastructure and introducing new technologies. Two, ensure that healthy and sustainably produced food is the most accessible, affordable, and desirable choice for all by embedding nutrition into all elements of the food system. 3. Expand financing and develop accountability mechanisms focused on directing resources and programs to the communities most affected. Over the next 2 years, there are key opportunities for world leaders to prioritize nutrition in policy agendas and to rethink our food and health systems. The Tokyo Nutrition for Growth Summit is specifically an opportunity to do the following: pool stakeholder resources for a joint output, renew and expand financial commitments targeting those most in need, make nutrition commitments that are ambitious and smart, establish a strong governance and accountability system for pledges and commitments. Malnutrition affects every country in one form or another. It is a significant global challenge, but one that we can overcome with our combined efforts. We need to act now. Thank you.
So thank you very much for that presentation. Let's now turn to our esteemed panelists and ask them to share with us their reflections and unique perspectives on the 2020 GNR. We have with us Johanna Ralston, CEO of the World Obesity Federation. Johanna has over 20 years of experience working in global NCDs. She served as CEO of the World Obesity Federation since 2017 and is focused on changing narratives around obesity and elevating it on the global agenda. Prior to this role, Johanna served as CEO of the World Heart Foundation from 2011 to 2016. We're also joined by Alok Kumar, Senior Advisor at Niti Aayog. As a Senior Advisor, Mr. Kumar manages a variety of portfolios, including health, nutrition, women and child, and education. Prior to this posting with Niti Aayog, he worked in the governments of Uttar Pradesh and Uttarakhand. So, Johanna, could I start off by asking you to begin with your reflections?
Thank you very much. It's a pleasure to be here, and thank you to the GNR team for a fantastic report and a fantastic session. I also want to thank all the many people. There's more than 1,000 people on this webinar from Cambodia, Kenya, India, of course, Pakistan, Nepal, Sri Lanka, all over the world, US, Australia, Saudi. So I just really want to thank everybody on the who has joined us today for such an important session. It's a excellent report that has really, I think, become able over the years to be even more specific about and sophisticated about the complexity of nutrition, the importance of it being on the global agenda and receiving greater attention than it does. I'm just going to make a few observations, and then I'm very much looking forward to hearing from my colleague Alok Kumar as well. So again, just to reiterate that the report itself focuses on food systems, health systems, and financing as the keys to unlock to achieve our ambitious nutrition goals and to finally start to make better progress towards the malnutrition targets that we have in various instruments of the UN, WHO, et cetera. But first, it seems important to acknowledge how COVID has changed, and I wanted to also thank the authors for producing a very effective and powerful new forward that takes on board the implications of COVID. So the one from the obesity perspective, one thing that we're seeing, and I think we're seeing the term obesity much more frequently referenced now, is that obesity is clearly associated with complications of COVID. There's no question about that. There's finally new independent research around that verifies it's not just as part of its association with cardiovascular disease or diabetes or other NCDs, but it's in its own right. clearly highly associated with this. And that was first found in the original data that was collected in Wuhan. In France, there's been significant data around this in the US, in the UK, and in other countries. Again, BMI is not systematically, data is not systematically collected. As Dr. Reddy also noted, BMI is an imperfect measure, but I think it does speak to the importance across the nutrition, undernutrition, as well as overweight and obesity spectrum of collecting, and particularly in this time of so many people being in the health system, of collecting consistent data around height and weight. So that is something that I think is COVID is only amplifying. We are, and the equity issue is driving so much of how COVID is playing out. It's exacerbating it's revealing the inequities in the health systems, but also in food systems. And then we're seeing some, very, I think the complexity of the food system per se wasn't really apparent until COVID revealed that, it's a complex chain. That's why we're seeing such strange disconnects as the Belgians being encouraged to eat more frites because of potato crops, so that the potato crops don't go bad. So that on the one hand, we're seeing, animals being killed and buried and food going to waste. And on the other hand, massive undernutrition and food shortage. Food insecurity is the common theme. So that these are just some of the myriad ways that I think COVID itself is revealing inequities in the systems and the importance of a nutrition-focused effort. A few other points, and then I really do want to hear from my colleague and then respond to some of the excellent questions, is that we're also seeing how some of the imposition of trade restrictions is having an impact on food supply chain. And this in and of itself will have a continued effect on malnutrition in all its forms. We strongly support the recommendations in the report of the integration of nutrition into health systems and health and into nutrition plans. In the area of obesity, it's an important factor that often, when a patient with obesity presents in the healthcare system with a comorbidity, a complication, it's perhaps the first time that the concept of nutrition has really been discussed in the healthcare system, and is a great opportunity, one that we need to coordinate across themes. And so then more broadly, I want to just go back to the global syndemic of undernutrition, obesity, and climate change, which is the result of the Lancet Commission on Obesity report that came out a year ago, which identifies that in fact, obesity, overweight, and undernutrition are really two sides of the same coin, and that they are also share the same drivers with climate change, particularly in the areas of urbanization, transportation, agriculture, land use, and then more broadly food systems. And that the syndemic report, which you can find online, both with World Obesity Federation and on Lancet website, offers some concrete policy recommendations for how we can have, as we say, double and triple duty actions, double and triple duty wins. I want to just make one more quick point, which is around the role of the private sector. And this is me speaking as from my own perspective. The private sector has certainly been a cause of many of the challenges of malnutrition and sort of a broken food system. But indeed, the food system isn't necessarily broken. It's just delivering what it's designed to deliver in large part, particularly in the global food system, which is it's meant to deliver shareholder value. And that's been at the expense of, that's been in a way that has privatized the costs, the benefits, and socialized the costs. We need to flip the script on that. But there are opportunities, I think, to incentivize, large asset managers, for example, who are increasingly getting out of areas like coal, divesting themselves of other assets, and that we can put a healthy pressure on them to show the true cost of food, so that we can then show the full benefits of food, and again flip the script. And then my final point is really that we hear a lot about, I think in the beginning of lockdown, we were hearing a lot about going back to normal. And I think we can probably all recognize that we aren't going to go back to what was, nor should we probably. This is an opportunity for us to change things, but it's also an opportunity that that if we don't change things in positive ways around the global nutrition, change will happen anyway, because change is inevitable, because the impact of COVID is so extraordinary. So that's where I think the recommendations in the report are magnified in urgency. We promise at World Obesity Federation, and in our own role, to do what we can to take forward these recommendations, to work with common purpose and cause with all of you. And I want to just again thank you for that, and I look forward to questions, and I also look forward to hearing from my colleague. Thank you.
Thank you, Johanna. If I could invite Alok to please share his takeaways from the 2020 GNR.
Thank you. Thank you so much, Rini, and thank you for inviting us over. At the outset, let me compliment and congratulate the team GNR for an excellently produced report, wonderful report. I think this will go a long way in terms of focusing people's attention, because nutrition is a big challenge, and particularly so in India, where I think we believe that it is the single biggest challenge, if at all, India is faced with. And sometimes, even though it is a big challenge, but sometimes it doesn't get the amount of attention that it does. It doesn't make into big political forums. And that is the tragedy, because we see, almost like slow withering away of our children and our future generation. And therefore, I think of our future workforce, which would, impact the productivity of the country. And therefore, I think it is very, very appropriate that we are releasing this report today. So my compliments to the team. I would like to confine my submission to what India is doing to address that. What are the highlights? What are the challenges? And a few pointers as to our thinking of where we are going in the future with respect to this. So the first point I need to make is that if you look at in terms of the sheer food security infrastructure that India has created, 1.4 million Anganwadi centers where we take care of the kids and pregnant women, a large network of public distribution systems, fair price shops where subsidized food is made available to almost like 75% of the population. 3.4 million frontline workers who interact on a day-to-day basis with the families. So if you look at the infrastructure and the amount of money and the focus that the government is giving, we have been, in some senses, really focusing on the idea that we need to take care of our women and children, because that would be, in some senses, be required even for the economic growth, apart from the justice and social considerations. Even in this time of COVID, I would like to inform, how do we reach? So we have about 103 million women and children enrolled in our ICDS services. And in the times of lockdown, to make sure that they don't suffer, or to ensuring the logistics of reaching every household is really a great challenge. But I think the government has done a great, and I just checked up with the ministry, and they are telling me that they have been able to make sure that our frontline workers are able to reach every single household, even during this economic lockdown, so that maintaining the norms of physical distancing. Through the infrastructure of the electronic funds transfer, India is unique, as you are aware, of what we call as the JAM Trinity, a bank account, a mobile phone linked to the bank account, and an electronic transfer platform based on biometric IDs of the citizen. We have made sure that every entitlement which the women and children have are being met, and money is being paid, not only of the entitlement, but there has been some additional announcements by the government to bring relief, because we see that the economic lockdown is creating unprecedented distress, particularly in the poorest and the most vulnerable, and therefore they need to be taken special care of. So the government has announced extra rations, some cash support for the next 3 months. And I think that we are making a case that maybe this could be increased further. The second point I would like to say, this is only insofar as the current crisis pandemic is concerned. On a more systematic level, I would also like to point out a piece that one finds mentioned in the Global Nutrition Report about the aspirational districts program. So when we talk of India and high stunting levels, somebody pointed out, I think it was Renata who pointed out in a report that we have very high levels of stunting, and it is true. But the distribution is pretty skewed. So there are districts and states within India which have much lower level of stunting, which could compare favorably with world averages. And there are districts which are so worse off. And so what we have done is we have, under the inspiration of the Prime Minister, we have launched what is called as an aspirational district program. And this is about improving health, education, and nutrition indicators in the most vulnerable districts. So the idea of equity that is the central theme of the report finds there. And I am happy to report that because of focused intervention, we suddenly see a huge surge in the availability of the services and the improvement in quality of services to the last households. Because what we had found is that we had almost reached 60% saturation, 50%, 60% saturation levels of the households. But those final 30, 40%, which are the most difficult to reach households, were in some senses left behind. Because of this unprecedented focus, we are able to reach many more households. And there have been substantive jumps in early registration of pregnancies, for instance, reaching all the other health services. And the third point and the last point that I want to make, and we look forward to questions after that, is we all agree that nutrition has multiple determinants and largely social determinants. Therefore, concentrating it on food alone will not do. So how do we get, and I think this point was made by Herda, how do we get all other ministries to come together on a platform? And we have, in the last 2 years, has been very exciting. A lot of work has been done. And we have this new program, which we call as the National Nutrition Mission. In Hindi, it is called Poshan Abhiyan. And that is an attempt to bring all the stakeholders who impact nutrition on a common platform. And I am happy to say that in the last 2-3 years, we have a whole host of initiatives and whole host of new programs which are being launched. For instance, early child care was a big gap in our overall system. So the intensified home-based newborn care program has been launched. A home-based young child care program for between 6 months and 24 months. We had very low levels of complementary feeding. So how do we make sure that, so that program has been launched. Anemia Mukt Bharat, almost 50% of our women suffer from iron deficiency. And so we have focused, a campaign around anemia, eliminating diarrheal deaths campaign. And then lastly, the maternal and benefit entitlement under the what is called as the Pradhan Mantri Matru Vandana Yojana. So what I'm trying to say is, and then we had this whole campaign around sanitation, open defecation free environment, which would lead to lower burden of disease, and that would perhaps have some impact on the outcome. So there has been a flurry of activity around nutrition. Nutrition is receiving some level of attention. And we have a coordinating body which is housed in this Niti Aayog, of which I am a part, which tries to get all the stakeholders together to make sure that we act simultaneously on all fronts so that to optimize the impact. I will limit myself with these, and maybe during the question answer session, I can add more or elaborate more upon this. Again, thank you so much for having me here. It is a great honor and a privilege to have interacted with be in such august company and interacting with. I see a lot of interest on the net. We have so many participants, so many questions are being fired. So thank you so much for having me here.
Right. Thank you very much, Mr. Kumar and Johanna, for those observations. And building on these reflections, let's take this forward now and get some of the questions to the co-chairs who are also here with us, as well as our panelists who will be here. Just a reminder to the audience members to submit your questions through the Q&A box, along with your name and organization you represent. And do bear with us. We'll try and do our best to make time for a couple of questions. So my first question then goes out to the co-chairs and relates back to my introduction of the report. How does the COVID-19 pandemic reinforce the importance of the 2020 GNR recommendations? Dr. Miha, would you like to answer this first, and then Professor Manar can join you?
Yes, thank you so much. There are actually 4 key messages that come out of the 2020 Global Nutrition Report, each of which has a heightened significance in the face of the COVID-19. 1, nutrition well-being for all, particularly the poorest and most vulnerable. 2, the need for equitable, strengthened, and resilient health systems. 3, the need for equitable, efficient, and sustainable food systems. And 4, the way forward, which is through strengthened coordination, financing, and accountability. I will cover the first 2 and then pass on to my fellow co-chair for the other 2. COVID-19 does not treat us equally. On one hand, undernourished people have weaker immune systems that may put them at a greater risk of severe illness due to the virus. At the same time, poor metabolic health, including obesity and diabetes, has been strongly linked to worse COVID-19 outcomes, such as the ones mentioned by Johanna and as emphasized by Johanna as well, including risk of hospitalization and death. People who already suffer as a consequence of inequities, including the poor, women and children, those living in fragile or conflict-affected states, are both affected by the virus and the impact of containment measures. So focusing on nutritional well-being for all, particularly for the poorest and most vulnerable, should be at the center of our response. COVID-19 has also exposed deadly healthcare disparities. We see that even the strongest health systems struggling with the high healthcare costs and a shortage of medical personnel, equipment, and facilities. Transformed and strengthened health systems must focus on delivering primarily preventive nutrition and health services for all and be ready to respond to crisis. This year's reports highlight the need to integrate nutrition into universal health coverage as an indispensable prerequisite for improving diets, saving lives, and reducing healthcare spending, which is now more important than ever. I will now pass on to Venkatesh for the food systems and the way forward. Thank you.
Thank you, Renata. As Ms. Fabbri highlighted, the global crisis has had a devastating impact on food systems as well as family incomes, making it even harder for people to access healthy and sustainable food. The gains that countries have made in reducing hunger and malnutrition over several years could be lost very quickly. The recommendations of the report therefore assume even greater importance given the urgent need to protect those gains through increased and well-targeted resource allocations focused on nutrition, through more equitable, resilient, and sustainable systems for food and health security. And these should be backed up by responsive social protection mechanisms. And we heard a little bit from Mr. Kumar about actions in India in that area. We also hear of the exceptionally large resources being applied to combat the pandemic and its economic impact at different levels. But this should not come at the expense of essential public health and nutrition actions outlined in the report. Special attention to it should be paid to supporting women as they play such a critical role in helping societies everywhere become COVID ready. I think contributions from all sectors of the society beyond governments are needed to address this challenge, which is really unprecedented that the world has ever seen. In addition to the government, we should have the private sector. And Johanna spoke a little bit about ways in which the private sector could be brought more strongly into this effort, and civil society organizations, and that has been stressed as well. Looking beyond the present emergency, we must learn from the challenges posed by COVID-19 and turn them into opportunities. We should work to reshape our food systems to deal not just with this emergency, but to comprehensively address the larger diet-related health crisis that is highlighted in the 2020 report. Thank you.
Thank you very much, Professor Manar and Dr. Renata Miha. Well, moving on, this report highlights the poor diets and resulting malnutrition as among the greatest current societal challenges. Alok, if I could come to you, could you tell us or share with us what might the global community learn from India's experiences and the work that we've done on malnutrition?
So a couple of points that one wants to make. One, if you look at the systematic way in which we created, both on the health side and on the nutrition side, a cadre of workforce and infrastructure right at the community level, is something that I think India can be proud of. The second thing, if you look at the food security, so if you look at India in 70s and India today, the agricultural systems and the way they work, but there were many positives out of it, but because of our agricultural policies, we have promoted rice and wheat more than many of the other crops. So therefore, the micronutrient problem is in some senses a result of the success of one set of policies. So I think there is a need to learn also from the successes, but there are also needs to learn from where those policies are really hurting us. And if you are aware that the micronutrient deficiency problem is now becoming more and more important. One other thing which I forgot to mention is we are now looking at fortification as a way out of the micronutrient problem. And we have recently notified standards for fortifying oil, milk, rice, and also flour. And I think some part of, but it is slow to take off because people are, sometimes technology, logistics, quality control, many of the things get together. But I think those are the three broad messages. And the last part, which I would like to stress, which is, the unprecedented emphasis which the government has paid in the last 5 years on sanitation coverage, open defecation-free villages, and the resultant, control on the burden of disease. And in the current 5-year term, the resolve to get clean drinking water to every household. So I think these two together will also go a long way in terms of addressing some of the social determinants of malnutrition.
Okay, thank you very much, Mr. Kumar. We're also keeping our eye on the time that we're having on online. So I'd like to now move to Johanna. Johanna, India is focusing primarily on undernutrition, and the report, as you have said, reveals that investments have so far focused on addressing undernutrition. However, there is this growing funding gap, as it were, to address overweight and obesity issues. What, in your opinion, can be done to overcome this major issue?
Thank you very much for that excellent question. So I think the funding gap, it's probably one of the reasons I mentioned the private sector. Funding doesn't only come from donors, it comes from freeing up resources or aligning resources. And conversely, lack of funding doesn't just come from donors not funding, but sometimes from us not aligning our own efforts or wasting resources that could be better purposed together, which is, again, that's one of the areas where opportunities like triple duty actions can be so helpful, where we're trying to sort of get a 3 for the price of 1 type of action out of something like the global syndemic approach. But certainly, I think that increasingly, and it's one of the reasons that I am so appreciative of the GNR, is that this recognition of kind of undernutrition and overweight and obesity being really the same the same issue, not with multiple dimensions and attributes and drivers is key. And really focusing as much as possible on the common drivers is one way of saying, investing in this is going to pay off in terms of overall health, well-being, and in fact societal well-being beyond just health. If people are really on the undernutrition side, not just not just being seen as needing more calories, and then certainly on the overweight and obesity side, not just having kind of an oversimplified view of eat less, move more, that sometimes is the case. So I think seeing nutrition as malnutrition as one common issue more and more, and building our systems and even the language that we use around that is very important. And then that's again, Nutrition for Growth Summit it's an important area. I've been part of the planning for that as well, so that we really have the full holistic view of malnutrition in all its forms. Those are some of the ways, and again, trying to aim for double and triple duty wins, but also understanding that every sector has a role. And I think as Alok Kumar was talking about, sometimes the unintended consequences of subsidies have certainly contributed to the problem. Seeing subsidies and private sector investment is actually part of the same spectrum of needing to be aligned around a common health and nutritious food effort. I hope that makes sense. Thanks.
Okay, thank you very much, Johanna. As I mentioned before, we've received a huge number of questions and really a very varied variety of questions, as it were. But we're sadly out of time, so I'm just going to very quickly go to the co-chairs and request them to share their final remarks, comments, or reflections, as you want to call it. If we could start with you, Professor Venkatesh Manar, your final comments.
Thank you, Rini, and I understand that we are running out of time. My closing message, and we've heard some great insights from all the speakers. I would close by again highlighting the fact that I think the COVID-19 pandemic has further revealed gaps in our food systems. And I regard this as an opportunity that we have to act in coordination to address those gaps and to ensure that healthy and sustainably produced food is the most accessible, affordable, and desirable choice. I fear that if no action is taken, the effects of the pandemic will only make it harder for vulnerable communities to protect themselves against malnutrition. And therefore, the importance of redirecting resources to those communities and people most affected is the right and the smartest thing to do. Thank you.
Renata, would you like to come in with your remarks?
Thank you. Thank you so much for the great discussions and obviously this great participation from everybody. It's pretty exciting, actually. The COVID-19 pandemic has changed the world around us and has also made clear that food and nutrition are now more important than ever. This is a critical moment in world history and one that should define how we act on nutrition. 2020 must represent a turning point for nutrition. We need to come together, invest in nutrition, renew and expand commitments, and strengthen accountability if we want to prepare our food systems and health systems for future shocks and also avoid a reversal of gain. Thank you again so much, everybody.
Thank you so much to our co-chairs and our speakers. Well, we've almost come to the end of the launch. So thank you for offering us your valuable contributions. I see that we've still got Dr. Reddy with us. So thank you very much, sir. And thank you to our panelists. I'd like to also thank the members of both the independent expert group and stakeholder group for bringing to us this very important report. And of course, thank you to our audience who've joined us wholeheartedly today. Finally, a special thank you to Dr. Rajan Shankar, Director of Nutrition at Tata Trusts, and his team, and the team at Development Initiatives, the report Secretariat, for bringing us this launch. I'd like to remind you that this launch will be uploaded to the GNR's YouTube channel, as well as its website and other social media platforms. I encourage you to visit the GNR website, download the report, and of course, engage with the GNR via social media. Physical copies of the report can be ordered from the website. Please do keep a lookout for future GNR engagements as well. So thank you very much for your time. Wishing you all a good day and a good evening.